Hello and welcome to the PET assessment lecture presentation where we're going to tell you all about the assessment. So the assessment's divided into two. You've got the computer assisted assessment, the CAA. That's on the 26th of April in the afternoon, and then you've got the Vivas. So if you're Group A, you'll be, or you've already spoken to me already, you'll be on Wednesday the 23rd. Part-timers, you'll be on Thursday the 24th, and Group B, or unless you have spoken to me, will be on Friday the 25th of May. Okay, so make sure you know those dates. They are pretty important. So let's work out how PET is graded. So your CAA counts for 30% of your total mark, but the majority of your marks, 70%, are in the 30-minute Viva. So you've got to get 40% to pass each of these, and if you did fail, highly unlikely, you're going to have to only resit one of those. So don't worry too much. So semester one, what did we cover? We introduced you to the fact that exercise drives a system of systems. Then we broke it down into the components of fitness. Fess up if you've got an ab pack. Then with the mind, movement, connection, functional movements, push, pull, twist, twist, resist, gait, lunge, squat, hinge. Then we did some functional strength and conditioning, so applying that. Then we talked about balance and proprioception. We learned that good movement comes from good posture. Then we learned about the biomechanics and of the body and why that's important in physio. Then we learned about the mind-muscle connection. We studied range of movement. We talked about exercise communication and feedback. And then finally we learned to prescribe exercise. That was all at the end of semester one. Moving on to semester two, so we know the importance of a needs analysis, the task and the individual. Then we went on to exercise outcome measures and of course screening, the PAR-Q and so forth. We talked about the hypertrophy heart connection, then the heart hormones connection. We've designed group exercise and we all had a go at that. I thoroughly enjoyed that. Then you're going to have your Viva practice session, your cardiac rehab session and some hydro as well to look forward to. So the three case studies are found on Blackboard in the assessment folder, and if you go to summative assessment you'll find them in there. So we've got four. The first one is Sam, then we've got Bethany, then we've got Eleanor, and then we've got our cardiac rehab group. So Sam has his post-op ACL reconstruction, Bethany's had an ankle inversion, and Eleanor has fallen over and hurt her hip. With the cardiac rehab group we've got 5 separate patients and we'll introduce you to them in a second. So Sam, as I said, he's your right ACL reconstruction, so we've got to think of a program for him. Then Bethany, she's injured her right ankle playing netball. And then Eleanor has fallen over and hurt her hip. And then we've got our cardiac patients, Ahmed, Jeffrey, John, Natalia and Peter. So the Viva, okay, you're going to be told on the day which case study you have. So you might get one of the individuals or you might get the group. And you're going to be given 5 minutes to prepare for this and read over your case study. But you've got to prepare all 4 case studies. Then you have your 30-minute exam. You're allowed to bring 1 sheet of A4 paper into the exam with you. There's going to be 1 tutor asking you questions and examining you, and then 1 moderating. So the exam format. After you've had your 5 minutes prep time, you're going to have 5 minutes to discuss the goals, short-term and long-term, and your treatment plan for this patient in terms of exercise. Then we've got 10 minutes for you to demonstrate 2 aspects that you've prepared from the exercise program and how you're going to progress these. So it could be balance and proprioception, could be strength, could be local muscular endurance, whatever. Then you've got to demonstrate a relevant outcome measure that's appropriate to that. Next 10 minutes. So that's the practical side of stuff. Then more of the theory. You could be asked anything with regards to the principles of exercise therapy. You're going to be asked to justify the exercises you prescribed according to the needs analysis of your case study, and you've got to think about safety, precautions and contraindications to exercise. Then there's a 5-minute wash-up time to ask you anything that we need to, just in case you've forgotten something you want to come back to it. So if we break that down further, Okay, your first 5 minutes is discussing the problem list, the short-term goals, the long-term goals, and the relevant outcome measures you're going to use. 5 minutes to do that, then you're straight into the practical, where you demonstrate 2 exercises that will focus on a particular component of fitness. Balance and proprioception, strength, power, whatever, range of movement. Okay, and then you've got to either progress these or regress these accordingly. Then you've got to demonstrate that relevant outcome measure. After that, you're going to be asked to stop the practical and then sit down and be asked some questions on safety, precautions and contraindications towards exercise and your particular case study. You're going to be asked to justify why you prescribe those exercises according to the needs analysis of this patient, and again ask questions on the principles of exercise therapy. So if you got the group case study, cardiac rehab, you discuss the problem list for the patient within that group. So for example, it could be John, could be Natalia, could be Jeffrey, whoever. Okay, you can recall their contraindications and precautions for cardiac rehab. You're going to demonstrate a relevant outcome measure, and then you're going to be asked to stand up and demonstrate one component of group exercise. So imagine you're teaching a big group. You'll only be teaching one person in the exam. You could be given the warm-up, the cool-down, introduction, explanation, whatever. So the case study based questions, so you've got to identify those 3 main problems for the needs analysis. Then you've got to identify one SMART goal that is short term and one that is long term. You've got to discuss the rationale for these goals. I would ask you to use the biopsychosocial method and think about holistic and cultural perspective of these goals. So what level of detail do you need? You need to include things like needs analysis, meaningful task, the 4 P's of functional movement, relevant outcome measures, components of fitness, exercise prescription, progression, regression, adaptation and overload. The other areas assessed will be related to your case study, making sure you're using that holistic biopsychosocial approach, thinking about contraindications and precautions, your communication and communication style, and the skill of which you taught that exercise, and of course always safety. If you have any questions, they will all be on Blackboard. All the support you need is always on Blackboard. There will be a practice computer assisted assessment coming up. Don't forget you've got the mock Viva on the week 29. Your case study for that is just in, and the questions I've already put them on Blackboard, so you can have a look at those and start preparing for your mock Viva. There's lots of online resources. If you do have a question, please just email me and I will get back to you. Good luck with your revision, and I wish you all the best in preparing for PET. See you soon.